We're very pleased to be here in Antwerp and very excited to start our program managers meeting this year. We're glad that the meeting has been hosted by University of Antwerp.
Well, we are very proud and very happy that the World Health Organization Europe has chosen the University of Antwerp and the City of Antwerp to have this program managers meeting. There are several sessions that are devoted to objectives of this European Vaccine Action Plan, and they will highlight tailored activities to raise coverage in different countries. They will see how immunization activities will fit into the existing health infrastructure of a country, so very much country-oriented.
A very warm welcome to Antwerp.
In effective stewardship of immunization program.
I'm working in the Public Health Department of the European Commission in the unit that deals with health threats, and we are interested in surveillance and management of crisis of communicable diseases, and in that regard we also have an interest in vaccination.
The ministers want to do what the public want to do.
The regional committee has recommended that the European region set targets for control of hepatitis B in the region, and so they invited me to be a temporary advisor here to help with the discussion. In 10 minutes I'll be on stage and you can see whether that was a good idea or not. This is deaths from hepatitis B immunization.
One of the key ways in which we change things is by sharing experiences, and the people in this room do not have that opportunity very often. So I think it's more about the convening of getting us all in the same place at the same time. These people are the managers of their immunization programs in their countries. They are senior technical decision makers around vaccination. So having them all in one place, sharing experiences, hearing the presentations, questioning each other's actions and helping each other is highly valued.
In less than 6 seconds you can communicate effectively some public health messages.
For us the most important topic is communication. We need to invest more in communication and communicating in the social media, and the prevention is the most effective strategy to have a healthier world.
I enjoy Antwerp very much, and I was very happy to hear this meeting was going to be held in Antwerp.
Being in the university adds an extra bonus, if you like, to being here, because the university have this history of managing events such as this. I think it's very important. She gives us an extra dimension in terms of visibility. When she lends her voice to a cause such as ours, it has more impact.
So here is an example of the age of distribution of measles cases.
It's very important that from different sources, from different angles, people could have the same message. From media, from specialists, from royal family. It was really encouraging, and looks like Her Majesty really understands and really is encouraged to do the best.
You did a great job to speak what you do in your country.
Vaccinology is fascinating because it's so broad. You need to know the immunology, but you need to know how people react. So social science goes hand in hand in what we do. The schools are very good in finding out vaccination status. We have tried the methodology tailoring immunization programs in populations where we see outbreaks or we fear of outbreaks because of low coverage since a long time. And those groups are undocumented migrants, it's anthroposophic communities and the Somali community.
We've been thinking about the most vulnerable and marginalised populations, the populations that are most in need of support and whose children are most in need of vaccination. I feel there was good interaction with the audience.
Smile, please.
Happy birthday to you.
Right.
I enjoy that we have a lot of interactions and share experiences between countries. And I think that's the organizers' plan, to have us all interact and speak.
Очень понравилось. Я считаю, что на высшем уровне все проводится. Все очень хорошо организовано. И конкретно мы получили ответы на все те вопросы, которые нам нужны в нашей работе.
Every country has a different approach to the immunization program and everything, and when we hear that others have other problems or similar as ours, we can search the solution ourselves.
You know, we have a policy. I think that that's a very important question. What happens after tomorrow and what happens till next meeting?
Well, we need to consider what we have learned and what we have exchanged and how we can implement it. But also it's some kind of reassurance what we already have in place. It's already good, I think. So there's always room for improvement, but it also reassurance that what we're doing is good.
At the end of the day, they have to go back home and do the work which is really in accordance with this European Vaccine Action Plan.